Welcome to the third event in the Shops Plus Accelerating Private Sector Engagement End of Project series. My name is Caroline Quijada, and I am the Deputy Project Director for the Shops Plus project. Before we begin, I want to let you know we are recording this event and plan to send the recording to all the registrants next week. During this event, everyone will be muted, but we do want to hear from you. Please use the chat function to comment and ask your questions. We will have time at the end to answer any questions you share throughout the event. If you'd like to adjust your audio connection, you can do so by clicking on the options button, the three dots. If you are having any technical difficulties, please ask our host, Kayla Thompson, for support. Now, welcome to our session, Supporting Health Markets, a conversation with Shops Plus thought leaders. For those of you not familiar with Shops Plus, it stands for Sustaining Health Outcomes Through the Private Sector, and it is USAID's flagship private sector health project. Shops Plus is coming to an end, and this webinar is third in our four-part end of project series on accelerating private sector engagement. The previous two webinars highlighted achievements and lessons learned in the areas of stewardship and financing, respectively. And webinar recordings are available on the Shops Plus website and via the link that we just sent out in the chat. Today's session will focus on health markets, highlighting Shops Plus's experiences, best practices, and lessons learned over the last 6 years to support optimal health markets in which all individuals can access the full range of quality products, services, and information that they desire. Reaching this goal relies on a range of interventions, and today I will sit down with 4 Shops Plus thought leaders to talk about their experiences with market development. I hope you find these conversations interesting and that they share new thinking, generate learning, and spur dialogue. I'd like to introduce today's panel of speakers. Ganesan, based in India, is our Senior Private Sector Advisor with Apt Associates, and he has led much of the market development work in family planning and HIV for Shops Plus, and he will set the stage to talk about its importance. Michelle Weinberger from Avenir Health is the Modeling and Segmentation Advisor for Shops Plus. She will talk about the power of data in pursuit of optimal health markets. Mbogo Buni, based in Kenya, is our Senior Private Sector Advisor with Apt Associates, and he will share Rwanda's efforts in successfully removing policy barriers to expand market access for injectables. And my final conversation will be with Sumitra Ghosh, the Senior Private Sector Advisor for Apt Associates, who was based in Afghanistan and who is now in India, but who will share his experiences with new product introductions and the importance of demand interventions in healthy market growth. If you've joined us for the last 2 webinars, you'll have noted that today's session is a little different. I will start with individual conversations to allow us a deep dive into the work and experiences of my distinguished colleagues. Then I will bring all of the thought leaders together for conversation and questions from you, the audience. I encourage you to submit your questions throughout the presentation using the chat feature. I now invite Ganesan to join me. Welcome, Ram.
Thanks very much, Caroline. Happy to be here.
Great. I'm glad to have you, Ram. So, Ram, let's start with just setting the stage. In our work, we hear about market development, market shaping, total market approaches. Do they mean the same things, and how do they differ?
All 3 are frameworks or approaches that aim to improve the total market, that is to increase use or to improve equity and sustainability. That said, each has a specific focus or lens. The total market approach, or TMA, for example, emphasizes stewardship and coordination so that the products and services supplied by the public, subsidized, and commercial sectors are each targeted at the right population segments. So coordination among these sectors then aims to leverage the comparative advantage of each of these sectors to grow the total market.
And then what about market shaping?
Market shaping activities look to leverage the knowledge, the purchasing power, and influence of large buyers to improve efficiencies along the supply chain. For example, by reducing prices, decreasing supply fluctuations, or improving quality. Advanced purchase commitments, like for the COVID vaccines, is a good example.
So really sort of focused on supply.
So far, yes, the market shaping activities are focused on the supply side. The market development approach, on the other hand, is much broader. It focuses on rules, the opportunities and constraints that market actors work within. Uh, and these rules of the game are defined through these market support functions, regulations, financing, data and research, interventions in education and demand, and so on. So and MDA really aims to take a step back and look at which of these support functions constrain the growth of the total market in an equitable and sustainable way, and then how these root causes that can then be addressed.
So I'm curious, how much have the rules of the game, as you called it, how much has this evolved from the time we started supporting Health Market?
The rules and norms guiding the market are changing. Compared to a few years back, I think we're seeing much greater interest today in engaging the total market and including the commercial sector. A few trends seem to be driving this. One is a greater visibility into the market and the tools to visualize and interpret the data. And these have really helped all of us understand the markets and the gaps much better. At Shops Plus's private sector accounts, the FP Market Analyzer, both of which are online tools, are examples of such tools. And of course, the project's private sector censuses and assessments that we've done in more than 30 countries, I think, are excellent resources that are available for people to understand the total market much better. I think another factor is the potential decrease in external funding. As countries think about this and how to sustain access to critical commodities efficiently, the support functions in these countries are gearing towards how to appropriately engage the private sector. And of course, the whole set of innovations in digital solutions and self-care products is another, I think, very exciting development that's sort of contributing to this trend.
So Ram, in describing market development approach, you mentioned support functions. Talk to me about the role they play in achieving an optimal health market, and it'd be great if you could use an example from your work.
I'll take the example of our work in the HIV self-test kits market in Uganda as an illustration. In Uganda, there's a testing gap. A significant proportion who have HIV have not taken an HIV test and therefore don't know their status. And men from middle and upper wealth quintiles are a significant proportion of those who have not accessed a test, due to barriers related to convenience or anonymity. And some pharmacies were actually responding to this gap in an inappropriate way. What they were doing is breaking up the components of rapid test kits, those kits that are meant for use in facilities, and selling these individual components or to customers. And HIV self-test kits could obviously address this market gap, but distributors in Uganda had not yet entered the market. They were awaiting product registration and as well as clarity on the regulations that would govern sales and marketing of this product. They were also unsure about the market potential. What would be the demand for this product at an unsubsidized price, and how much of this demand would be undercut by this inappropriate use of rapid test kits that I was just talking about. So what we did is we convened a workshop and we shared our understanding of the market gaps and issues with the government, with the donors, implementers. And we also invited commercial sector importers to this meeting to demonstrate that they were interested in introducing this product into the market. And this workshop really catalyzed a set of actions by the Ministry of Health that facilitated the private sector provision of this product. So one, the Ministry of Health strengthened its regulations around this inappropriate use of rapid test kits. Second, it expedited product registration, which was an early stumbling block that in the market. And today, for example, there are 3 registered self-test kit products in Uganda. And I think equally important, the Ministry of Health, on behalf of the importer, negotiated a lower price with one of the manufacturers. And the importer then passed on the savings to the consumer, making the product so much more affordable to many more people. I think this is an example of how changes in the support functions can really grow a market without interventions directly into supply, distribution, marketing, and all of that.
Thanks, Ram. I agree. I fully agree. That's a great example of sort of illustrating these support functions and how they sort of influence how markets work. So this really sets up my next conversation. I want to invite Michelle Weinberger. Thank you, Ram. I want to invite Michelle Weinberger, the Shops Plus Modeling and Segmentation Advisor, to discuss the role of market data. Welcome, Michelle.
Thanks, Caroline. It's great to be here.
So I have to share, Michelle, I'm always amazed at what you can do with data. I may actually be one of your biggest fans. You and the rest of your colleagues at Avenir Health have done terrific work on creating tools and demonstrating the power of data to help understand the current market. So let's start with having you explain, why is data so useful to understand current market status?
Yeah, so something I found again and again all over the world in lots of different countries and contexts is that oftentimes I think people hold these preconceived notions about what a market looks like or doesn't look like. And often these don't actually line up to what the data shows. And so we spend a lot of time at Avenir thinking about how do we present market realities in really simple and understandable ways to help sort of sense check some of these notions and make sure that as discussions are happening about how to intervene, where opportunities are, that they're really based in the realities of what exists, as we can see in the data. If you've seen me present before, you know one way I really love to do this is by looking at data from different perspectives. And so looking at things both in relative terms as well as in absolute terms to think about what those opportunities mean. So maybe we can take a look at an example of this from Kenya. Here we're looking at data on the market share, so public, private, and other sources for each method. And if we look at this in this sort of relative term, the share of the market for each of these methods, we see that the private sector really dominates in terms of both pills and condoms, with 60% or more of users of these methods sourcing those methods from the private sector. And so as we look at this, we might think about there being big opportunities to focus private sector efforts among these two methods. However, if we overlay this with population data and the number of women using each of these methods, we start to see a bit of a different picture. Next slide. So what we see is that actually in Kenya, there are just not all that many pill and condom users, but there's a huge number of injectable users. And so in absolute terms, even though the market share of the private sector for injectables is quite small, only 37%, there's actually way more private sector injectable users than there are private sector pill or condom users. And so looking at it from this perspective, we might think of new or different opportunities in that market that we didn't see when we looked at it in relative terms. And this that we pulled from the FP Market Analyzer. We'll put the link in the chat and we can come back to look at this tool a bit more later, but it really helps sort of make this data accessible and available for a large number of countries.
Thanks, Michelle. I just want to say that, so just looking at data from sort of one cut or one lens can actually be misleading.
Definitely, yeah. And I think, you know, it's really important that we triangulate or layer our data together. And maybe to share another example of this. So even though we're in the final year of Shops Plus, we've been able to do some really new and exciting work this year looking at geospatial patterns in private sector use. And this uses a technique called small area estimation, where we look not just at urban rural and not just by region, but really delve down to look at these very small patterns of private sector use. So here I can show an example of this work from Nepal. We're looking at a map of the private sector market share. So the darker the color, that dark blue, is where most women who are using are going to the private sector for their method. And where you see that more yellow or that green color, it means that most users are sourcing their method from the public sector. So if we look at this map, we see some hotspots of private sector use, and then we see lots of areas where there's just not much private sector use. And we might start to think about, okay, well, what are the missed opportunities for the private sector in some of these areas? But if we were to layer on or triangulate some additional data, we might start to think about these opportunities differently. So here in the second map, we're looking at a map showing the population of women living on more than $5.50 per day. This is not meant to say that these women are wealthy, but to maybe give an indication of where you might have more opportunity for private sector services, especially those where there's an ability to pay. And what we see very clearly is that a lot of these areas that are really sort of heavily public sector dominated are also areas where there's just not a lot of women living on more than $5.50 a day. In some places, this is just because there aren't many women, right? A lot of Nepal is very mountainous and the population is very sparse. And in other places, there might be more population, but there's just much higher poverty rates. And so thinking about the potential role of the private sector in this context brings up some different questions around, if the private sector were to play an increased role in this area, it would likely need a lot of subsidization to do that. And so thinking about what it might mean. We also see, in maybe a reassuring way, right, some of those hotspots on the map on the left of where you have high private sector market share do seem to align pretty well to some of these very dark areas on the second map, meaning that in some ways the private sector already is sort of getting to the right places and serving those areas where you do have sort of larger shares of women who are able to afford those private services.
So thanks, Michelle. I think both examples, the Kenya and the Nepal examples, do sort of illustrate needing to go that extra step and getting a different cut of the data. So in addition to understanding the current market and assessing trends of how the market's changed, you have also used data to inform future market growth. So both you and Ram mentioned the FP Market Analyzer tool, which was developed by you and your colleagues at Avenir Health for Shops Plus. And this tool can model different what-if scenarios. So can you talk about the FP Market Analyzer tool that Shops Plus developed and give us a demo of how the tool works to support market development?
Sure, I'd be happy to. And I would encourage people to click on the link for this tool or visit fpmarketanalyzer.org so that you can follow along as we do this little demo. So the FP Market Analyzer is preloaded with data for nearly 60 countries. There's a drop-down list in the top left corner, and you can pick any country from that list, and all the data in the tool will update to represent that country. So let's take a look at Rwanda this morning, or this afternoon, evening, depending where in the world you are. So if we pick Rwanda from the top corner, we'll see this first page looks at the current landscape. I know, Caroline, you asked about the future, but before we get there, I just wanted to make a quick plug that there's lots of data that shows the current landscape, so similar to what we looked at for Kenya and some other graphs as well. So while we don't have time to go through this today, I would encourage you to scroll through this as well as looking into the future. So as we look to the future, we can click on the left-hand side on this policy scenario generator. So we've developed this set of 4 different policy scenarios that are sort of pre-made for you to use. There's also some custom build your own scenarios. So if you wanted to customize a scenario to a country based on some specific discussions that are going on, you can do that as well. But for today, we're going to stick to these policy scenario generator options. And we're going to have a look at scenario number 4. So if you click on scenario 4, it'll update the data to represent that. And scenario looks at 2 different things. It looks at what would happen if implants increase in popularity. And this is a trend that we're seeing in many countries, especially in sub-Saharan Africa. And then also we'll look at what would happen if the private sector were to play a greater role in the provision of long-acting methods. And we know this has been a big discussion as we see this trend towards more implants of sort of what is the role of the private sector and what would it take for the private sector to play a bigger role in that space. So the first thing we see on the method mix graph at the bottom of the screen is that big increase in the share of women using implants. That's that light orange bar. So you see it growing between the status quo and our future scenario. And then as we scroll down, we're able to see a lot more results about how things would change. So we'll just take a look at one of them. This graph looks at the total number of users by method and sector, with the two bars comparing the change. And so what you can see is that pretty dramatic change in the number of implant users, as well as a shift in the share of implant users going to the private sector. So that dark blue piece right on top. And if you hover over, you get additional information for this graph. And what we see is that dark blue segment represents about 80,000 private sector implant users. So for me, this number is really the key number to take back to policymakers and planners and country to think about, okay, could this happen? What would it take for this to happen? So first, there's a question about, do we have enough providers or the right kind of providers? If the private sector is mostly pharmacies and shops, right, then you might not have the right skill in the private sector to be able to deliver this large number of implants. And even if you do have that higher clinical skill in the private sector, what training and support and supervision would be needed to ensure quality of services for these 80,000 women who might be able to go get these methods? And so it really is meant to kind of help inform these what if questions about what changes are feasible and what would really be needed to help make these changes come to life.
Thanks, Michelle. I thank you for walking us through, giving us that demo. I just want to mention that the FP Market Analyzer tool, as well as some of the other tools that have been created, are available on our website. So I welcome everyone to take a browse. I also just, it does show, for example, that there is room in Rwanda to expand the role of the private sector. I think you gave us a great example using implants. But now I want to invite Mbogo, who's actually going to talk about Rwanda and some opportunities with the injectables market and how Shops Plus use data as a foundation to policy change. I want to welcome Mbogo. Thanks, Mbogo, for joining me.
Thanks, Caroline, and I'm glad to be here today.
So, Mbogo, we just had a terrific demo from Michelle on data analytics for optimizing health market performance. She used Rwanda as an example, but she focused it on implants. And I know you'll be doing quite a bit of work in Rwanda with injectables. So why don't you sort of set the stage and tell us a little bit about Rwanda and our efforts to expand the injectables market?
Sure, Caroline. I liked Michelle's choice of words with triangulate or layer. So to do that, I'll say, what we did is we took it a step further to layer now the data for the injectable market within Rwanda, and to understand how do the market segments look. And when we did that, you find that it was actually, we had lower injectable use amongst richer and urban women. And these are market segments that typically prefer private sector sources. So therein already shows, okay, there seems to be something that's not quite moving as would be expected. And to further understand what was happening in the market, we then looked at how does a private sector supply look like, and when we looked into this, we found that actually supply of injectable contraceptives through the commercial sector was way below demand. So demand was far outstripping the supply. So having established those 2 points, the third thing we looked at was, all right, if those 2 things are happening, is there a market that is able to pay for commercially priced products? And what we found is that actually when you look at the pharmacies were stocking products at a non-subsidized price points. And these products I'm talking about is like oral contraceptives. I'm also talking about HIV self-test kits and pregnancy test kits, all indicating that there was a market, there was a need, as I've said before, and that the trend was not as we would have expected. So all looking right for potential growth and involvement of the private sector. But there was a policy restriction. And the policy in Rwanda prohibited actually administration of injectables outside of medical settings, and pharmacies are considered non-medical settings. So this restricted that kind of expansion when we started the work.
There's always a but, right, Mbogo? So WHO has supported administration of injectables by pharmacists for years, but many countries don't allow it. So what made Rwanda open to this policy change?
Okay, well, I think Rwanda stands out because they do have experience. They do have experience with looking outside of traditional service delivery channels. So Rwanda, for example, community health workers can administer intramuscular injectable contraceptives. So that was kind of like a good precedent. So we Shops Plus started working with APO, a professional association in Rwanda, and APO stands for Association of Pharmacists and Pharmacy Owners in Rwanda. And on the slide, you can see the president of the professional association, Danny Mutembe, who leads the association. And they formed in 2010 with an objective of promoting ethical practice amongst their pharmacy and amongst their membership. And so together in 2019, we began working together to advocate for pharmacists to be allowed, in line with WHO recommendations, to administer injectable contraceptives. I mean, a lot of work was done, but in summary, I would say what we did is that there was a lot of consultation with key stakeholders, and then development of an advocacy plan, and then gathered kind of stakeholder support after their input to do the policy, the advocacy activities. And all this, of course, led by a lot of work by APO, culminated in February 2020 with the Minister of Health changing the policy to allow for pharmacists in Rwanda now to be able to administer injectable contraceptives, including intramuscular contraceptives.
So, I mean, even with the abridged version you just gave us in Bogo, you make it sound so easy. I mean, a policy restriction was lifted, policy was changed. But I know, and I've heard you say before in the past that changing policy can actually take a long time, that it's a long road. So I'm curious, like, what made conditions so ripe in Rwanda?
Yeah, true. So for the listeners, for the long version of this, the brief has been included in the chat, so you can get more details there. But as I think back and look back at the work Shops Plus and APO did, there were certain factors that fell in place and facilitated policy change. And the first factor was timing and the right environment. So what I mean by timing is that the MOH was keen to extend and to expand the involvement of the private sector for FP access. And right environment, I mean that Rwanda has a good enforceable regulation that can allow for task sharing for family planning activities. So I think that's the first factor. The second factor is the presence of a credible and motivated private sector champion. And APO as an association had been involved and had been working with the Ministry of Health on other initiatives, and so they were trusted. They had been collaborative in the past, and they did have the networks in both the public and the private sector. So this was key in helping to advance the discussions, in reaching out to different stakeholders to understand the perspectives. The third factor that I'd like to highlight is having a clear advocacy plan. So that means, present the evidence and present the need, in brief. And the last, but definitely the most important, was a consultative process from the get-go. And so APO had a lot of reaching out to different stakeholders. So we're talking about regulators, policymakers, their own membership, other health worker cadres, donors, to understand what are their considerations, what are their fears around policy change, and with each consultation, it informed the advocacy plan and informed implementation rollout plans.
So I agree that consultative process is really very important. I think also beyond just the policy change, right? Policy change is just the first step to actually increasing access. So what market support was required to put the policy into practice in Rwanda-Mbogo?
Right, yes. So the first thing was to get then the pharmacists to have the necessary skills to appropriately administer injectable contraceptives. And towards this, we supported the updating of FP guidelines in Rwanda to reflect the policy change, and also supporting the development of a training curriculum that can be used to train pharmacists going forward. And training and implementation plan discussions are ongoing in country. The second key item I think I'd like to highlight is about sustainable commodity supply. So if you think about, we're thinking about after policy change, what next? What needs to happen? The pharmacists need to access the commodity so they can be able to provide it to the clients. As mentioned earlier, supply in the commercial sector was far lower than demand was. Ram spoke earlier and spoke about market-based approaches have sustainability at their core. And he also spoke about pressure on public sectors to finance their commodity needs. So as we looked at that and considered in Rwanda, Rwanda at the time, by the way, was sourcing commodities and allowing some private sector access, specifically to health facilities. So when we considered that option with an increased demand in the private sector, we thought, look, this might not be sustainable. So it needed ultimately a commercial solution. And so towards this, Shops Plus and APO developed a business case. And on the slide, we see a team from APO that was, trying to crunch about how do we get sustainable commodity supply through the private sector. So we developed a business case, and we held a pharmaceutical partnerships meeting. So this means you reach out to the different players, and we reached out to 3 international suppliers of contraceptives, and up to 13 in-country distributors participated in this meeting. And the idea was to link, provide the information, provide the data, and then partnership discussions could continue. So those are ongoing on a case-by-case basis individually. And we anticipate that actually by next month, tomorrow, July 2021, that at least one commercial contraceptive will be introduced in Rwanda.
Thanks, Mbogo. We certainly look forward to tomorrow when we may see commercial products in Rwanda, and I think the community actually it's something that's going to benefit many in countries. So thank you very much. I want to turn to Sumitra, our senior private sector advisor and chief of party for the Shops Plus Afghanistan program. Sumitra will be sharing additional efforts, like Mbogo, to talk about new product introductions and increasing choice for consumers. So welcome, Sumitra.
Thanks, Caroline, and hello, everybody.
So Sumitra, I'm excited. I've been having all these conversations this morning. We just left Rwanda, and we learned about what policy change can bring to an injectables market. I know you've done a lot of work supporting health markets beyond policy. So to begin, I'd love for us to start by having you just tell us what some other market barriers that you've seen as in your work.
Thank you. Dominance of free subsidized contraceptives and other priority health products could be another important barrier. When it goes uncontrolled, it affects demand of the commercial contraceptives, the commercial health products. This in turn prompts the commercial marketers to restrict the product basket to the bare minimum by focusing on high volume, fast moving products like in family planning business, condoms and OCPs. And in such a scenario, Ram has talked about TMA, the total market approach. It's very critical to catalyze and shake up the entire market by introducing new products, innovative distribution channels, and attractive social behavior campaigns, essentially addressing the supply and the demand side barriers.
So I love the terms that you're using, catalyze the market, shake up the market. So tell us about Shops Plus's efforts to expand product baskets and introduce new products to shake up health markets.
Let me start with the new products. So we launched or we introduced several new products through our social marketing partners in Afghanistan, Tanzania, and Nepal. There are various kinds of products. So first kind I would like to talk about is a set of niche products which are very small volume and was not available in the private market. Things like progestin-only contraceptive pills or a chlorhexidine gel for umbilical cord care for the newborns. So we introduce these products at a price which can support the market and which can attract even the commercial players to come in later on. The second group of products would be contraceptives, where the basic varieties were available in the market. We introduced the value-added, feature-based contraceptives, whether it's condoms or ultra low dose, OCPs, essentially to excite the entire market, at the price which the commercial market segments actually are made of, which is a mid-price segment, I would say. And thirdly, we also introduce non-contraceptive products to open new avenues for growth, not just for the social marketing partners, but also for the overall health market. So there are key points here. One is that we have seen these introductions not only help the social marketing organizations improving their financial viability over a period of time, but also simultaneously attracting more brands in the market, more commercial brands, I mean. And the other important factor that remains is that we have tried to sort of build partnership between these social marketing partner organizations and the pharmaceutical manufacturers, essentially to sustain such efforts of coming up with new products and develop the market so that the private commercial actors can become more and more interested to launch their products.
So as more and more commercial products come in, I know traditionally we've supported a number of social marketing organizations. So how do we help them and how do we support them transition as we're seeing markets, with, increasing commercial presence in markets?
So, on one hand, we have the overarching goal of improving sustainability of the social marketing organizations, and at the same time, through them addressing the market barriers, the certain barriers that I was talking about. So in addition to new product introduction, we also helped our partner organizations, first of all, transition to a social enterprise model. So this could be done through two different strategies. One is increasing the revenue from existing and the new products which were being launched, and also helping them to diversify into new businesses so that they can sort of increase the income. At the same time, they're developing the market. The second is simultaneously improving the cost efficiency by adopting efficient procurement system, supply chain management, sales management, and digital health system, which could reduce the cost or make the whole operation more efficient and most effectively, the cost efficient. The second thing that I would like to talk about is that in these kind of markets that I'm talking about, there are inequities of access, and if you have to reduce these inequities, you need to expand the coverage and innovate new delivery channels, so that the access to these kind of products or services improve over a period of time to reach out to the underserved population groups. And we did it in two ways. One, again, adoption of third-party distribution models to serve the regular pharmacy market, while utilizing the in-house sales team to open up new innovative delivery channels, which could be either targeted to, a specific women group who are unable to access, or institutional sales, and so on and so forth. The other is accrediting, pharmacy networks to provide certain specific clinical methods, for example, or semi-clinical methods like injectables. And similarly, accrediting drug dispensing outlets to sell contraceptives in peri-urban and rural areas. For example, the first one, the injectable one, we did it in Nepal, Sangini network, and the second one that I'm referring to, which was done in Tanzania through the ADOS. The third kind of barrier, or approach, I would say that there are still very critical market barriers. For example, restrictions on emergency contraceptive sales in the private pharmacies in Afghanistan, or for that matter, price ceiling for emergency contraceptives and some other health products in Nepal. And in general, we have seen the non-inclusion of general practitioners in family planning training and service provision and so on. So these are the kind of barriers which hinder market expansion. And therefore, we work through these social marketing organizations to address these problems and overcome these issues.
So great points about how to support SMOs to become more sustainable and help them through this transition. So so far today, we've talked about catalyzing markets by using data. We've talked about policy. You mentioned services. We've talked products. I want to focus a little bit on demand. And Sumitra, you've always said how important it is to marry supply side interventions with demand side activities. And so can you share a little bit about some of the innovative social behavior change initiatives, including with non-health actors, that you've supported to help grow demand for private sector products?
That's an interesting question. So, when we talk about demand generation, there are two kinds. One is, the typical brand communication or brand development and brand marketing, which a commercial marketer can actually take care of. We don't have to sort of do anything for that. But there are issues, demand side issues, which require a lot more social behavior change communication, which is very cost intensive. Let me talk about Afghanistan, where social and cultural norms are conservative, as you know, and there are few safe spaces for women to gather freely and exchange information. So we engaged a variety of health and non-health actors to intensify demand for family planning usage. Let me start with some non-health actors. We leverage beauty parlors in Afghanistan. We train the owners of these parlors. We train the beauticians to counsel their clients on family planning, maternal and child health products, and even refer these clients to trained private providers for more information. So this initiative helped improve the women-to-women dialogue, social support for the family planning use, and increase women-friendly access to family planning products. And this led to, interestingly, adoption by the USAID's Urban Health Initiative to include both female as well as the male salons and explore potential to expand this kind of an initiative into peri-urban areas by doing some feasibility assessment. The second example that I would like to mention is that, there are normative barriers. So we reached out to the religious leaders and the imams in Afghanistan to address these normative barriers, particularly addressing, which is prevailing among the men folks. And this is related to family planning use. And this initiative worked very well. And the Ministry of Hajj and Religious Affairs endorsed the program and advised these imams at the mosque countrywide to disseminate information on family planning and maternal child health products during the Friday prayers or major events. My last example would be a health actor engagement. So as Shops Plus, we supported ASMO to start detailing the private providers on family planning provisions in Afghanistan, to counsel their clients, to dispel myths and misconceptions that prevail, and simultaneously sensitizing clients at these clinics who are waiting to meet the doctors to ask their questions to the trained providers. This again resulted in more discussions around family planning, generating more prescriptions for contraceptives by these trained providers. And most importantly, what we have seen now is that these results prompted USAID to explore appropriate approach to adopt a more formal and organized way of private sector provider engagement using lessons learned from the global as well as the regional health, high impact practices. So in other words, these are the kind of barriers that it's very, very difficult for the private commercial players to address. And this is where the social marketing organizations, the donors, the grant funding becomes very critical to address these barriers.
Thank you. Thanks, Sumitra. And I really do appreciate your examples and actually how they've been sort of adopted by either government or another USAID partner to sort of help scale those interventions in those efforts. So thanks very much. Thanks for sharing highlights from your program. Now I want to bring all four of my colleagues together, and I'm going to hop out of the spotlight. We've been receiving some great questions based on my conversations with my thought leaders, and I want to encourage you to continue submitting the questions to the chat feature. We have about 15 minutes, and we'll try to get through as many as we can. So I'm going to start by asking Ram a question, and Ram, that question is, what led to the breaking up of rapid test kits in Uganda and then selling them individually? So was it the cost? Why wouldn't they just sell the kits as they were? And do you find this happening in other countries?
Sure. So I want to first distinguish self-test kits from the rapid test kits in the sense that self-test kits are meant for a single test and for use without assistance from a professional, as all of you know, and rapid test kits are meant for use in facilities by a professional and usually come packed in a bundle, for 10 tests or multiples of 10 tests. So it's a bulk packaging. And and so what was happening was before self-test kits, that single-use product was available, there was still a demand from the consumer side for anonymous testing at home. But the product was not, supply was not there. And in order to meet this demand gap, pharmacists were breaking up the bulk pack, making their own estimate of, this is the amount of reagent you require, whatever. And obviously, sometimes those estimates were wrong and selling to consumers. So I'd say this is a natural reaction of demand existing, but supply, appropriate supply was not there. And our predecessor project, Shops, we'd actually done an assessment in about 5 or 6 countries, and we found instances of this occurring in I think all of those sub-Saharan countries that we did an assessment on. I do have to say that we did not quantify the scale, the extent to which this was happening, but we did see instances.
Thanks, Ram. I'm going to turn to Michelle. Michelle, question for you. The geospatial data in Nepal indicates where private sector already exists. How do private sector players themselves decide which regions to serve and services to provide? What kind of data do they use?
Thanks. It's a great question and important, right? That we not just look at the data sources we're used to looking at, right? DHSs and surveys like that, but also think about what type of sort of market intel private providers are using. I'm not a private provider. I can't speak exactly to what they're using, but I do think there are, some similarities, right? They're thinking about location of cities and towns and kind of population and places where there's willingness to pay. One thing we have been doing, I didn't show in these maps, but so Shops Plus supports and works with CRS, which is a private provider in Nepal, and we were able to actually map the geolocations of their outlets across this data. So also to look at sort of how their provision lines up with the different data that we're seeing and using this to then help have discussions with them to think about, where they might be able to expand into. And maybe I'll see if Mitra, not to put you on the spot, but if you want to jump in with any more thoughts, I kind of sit on the data side, and I know some of my other panelists here are much more sort of on the ground working with these private providers, so probably have some great insights from that perspective.
Sumitra, do you want to add how you worked with ASMO, you've worked with other SMOs, what kind of data do they use? How do they make decisions about where they'll sell products or where they'll deliver services?
I mean, in countries where the retail audit is available, you can always refer to the retail audit data. Like, for example, countries like Nepal, Tanzania, I've seen that, it is available. In Afghanistan, there is a data shortage. I mean, it's a huge problem getting accurate data and any data for that matter. So so you have to sort of depend on other, sometimes we have done a lot of retail studies, distribution studies to generate that data. And those cannot be sort of sustained over a longer period of time because of the high cost involved there. But in other 2 countries, we have seen that there is a lot more other data available. It is never sufficient. There is always a shortage, and it is costly to get the good data. So one has to sort of make a lot of guesstimates, and build, by talking to the trade, by talking to the people, the actors in the market.
Mbogo. So
Yep.
you mentioned 4 factors that made Rwanda a ripe environment for policy change. Can you elaborate a bit more on that first factor, which is the timing? How can we manage timing for policy change? I think it's a great question.
Yeah. Here's what I think. If it's policy change needs evidence, needs data to inform, to inform a reason for and a rationale for the change, right? And I think that what is needed is, if in the case of inclusion of private sector in providing more or doing more, is to demonstrate what currently and what potentially private sector could contribute towards certain national or regional goals. And so it builds up on the data aspect that we have discussed earlier, and some of the tools. So using existing data that can show this is what is currently contributed, this is what can be contributed, can then make people say, all right, if we need to get to goal X, will we do that with only our existing channels or the channels we have used in the past, or do we then tap into these new channels? So I'd say to make the timing appropriate is to surface the data, and we've talked about some tools that are available, censuses of private sector counts, FP Market Analyzer, or even DHS data, to layer it, triangulate it, as Michelle said, to better understand and say, all right, this is what is being done and what can be done. That creates a better timing.
Great. And would you say, Mbogo, though, that if there's a champion and there's some will and some data, that perhaps every time is the right time? It might be harder in some cases than others.
Actually, that's true as well, Caroline. And what I've talked about is like programmatically, but in the case of Rwanda, APO as a champion had already demonstrated this. I say that they were a credible champion. Credible is very important. So they had been participating, they had been engaged, they had been present. So that definitely contributes. So get the data, and then have the credible person who's been participating and is sharing this data.
Just a quick additional question, Mbogo. There's a question about policies with regards to self-injection in country. So are policies in place allowing pharmacists to administer or train women on self-injection with DMPA SC, or is just DMPA IM? What does the policy allow?
So the Rwanda was on the has advanced in its introduction plan for DMPA SC, and pharmacists are part of that introduction plan for DMPA SC. The policy that was passed allows for them to provide injectable contraceptives. So IM and SC are both applicable.
Thanks, Mbogo. Sumitra, there's a question for you with regards to what reflections and lessons do you have that other fragile settings can learn from your experiences in Afghanistan? So what other lessons do you have for other fragile zones?
I think the first and foremost, in the fragile markets, you have the kind of constraints that we're talking about, the supply related, and then you have the demand related, and those need to be addressed initially through the social marketing or the civil society organizations. At the same time, there are policy related issues and there are norms related issues, and that need to be addressed at a much higher level with the government. And that is not just the job of a social marketing organization or a civil society. It's essentially you need a group where the donors, the associations, and they all have to work together to address those issues. I am seeing some very related questions, like, a new product introduction is very costly. So, how do you sort of do that? Yes, absolutely. So any new product concept needs to be sort of, tackled through private, the trader provide, training, or the provider training, meaning doctor training, etc. At the same time, you got to do some targeted sort of, education of the consumers who will be your, sort of early birds to create a momentum in the market. And once that momentum gets created, automatically, the volume increases, and that brings in the private sector, the commercial sector players. I also have seen that, there are questions which are related to why social enterprise, and why, what's the difference between enterprise and social enterprise? The problem is, there are so much of access inequities of the existing in these markets, often a typical commercial approach will not look into those need gaps which are far-flung in far-flung areas, or which are very high cost for them to sort of reach out. So in those situations, it is a sustainable margin which is more important rather than a full commercial margin. And so that is a thin line difference. You have mentioned, David, that it's a profit. Yes, it is profit, but the level of profit or the level of margin that is, and so in other words, in every fragile market, there is a shortage of products. So you have to bring in these products, and these are new concepts, and so therefore you have to repeat this process again and again. There are these policy related barriers which you have to address one by one, and so prioritize with that larger group and take it up, and that is how you need to sort of address these issues, in my opinion.
Thanks, Sumitra. So I think we have time for probably one more question, and I'm going to address it. It came in from the audience, and I'm going to ask it of all of you, and give you some time to answer in your own words. But the question really is about building capacity and building capacity of local actors and in sustainable ways. And how do we continue to support healthy market development in ways that doesn't actually displace existing capacity? So we as a project, we're coming in and we're doing interventions, but how do we ensure that we are developing capacity along the way? How do we help market actors identify market constraints? How do we help them identify which supportive functions is affecting market performance? So I'd love to open it up. I'm not sure if one of you has a burning response now. Otherwise, I will call on Ram.
I can probably go first. Thank you. So I think building local capacity, that's a crucial and central question. And just like we talk about user-centered solutions, when we think about strengthening capacity of local partners, it again needs to be user-centered or the local partner-centered. So our strategy, and I think that's really helped us in working with many of these partners, has been to let, for example, the social marketing organization in Afghanistan or Nepal or Tanzania decide how the assessment is conducted. Usually they conduct an assessment themselves. So they do the analysis, the assessment. We work with them in prioritizing, but again, the local partner leads the prioritization in the roadmap and the strategy and its implementation. Therefore, I think that when the capacity building strategy is user-led and local partner-led, there's greater buy-in, there's greater sustaining and commitment to that.
Mbogo? You're on mute, Mbogo.
Thank you. Sorry, I'm thinking of two examples, and two come to mind. One is in Tanzania, and the other is the work we did in Rwanda. So when we speak of, we have come in and kind of tried to help develop tools that can be used by and work with the local partner to develop tools that work best for country contexts. And so, for example, in Rwanda, to help inform total market approaches, in Tanzania, total market approaches, I know we worked with the Pharmaceutical Society of Tanzania to collect market data. And the idea here being that, through the collection of market data with one round with us, and once the project ends and you move on, that capacity is left with a professional association or an actor that has an interest in that market growth. So that's one example that I can think of where you come and work together to develop, say, an approach or together develop tools that work best, go through maybe one round, maybe 1.5 rounds, and then that capacity is left in country to continue. So that's and we did that specifically with total market approaches in Tanzania.
That's a great.
Yeah.
Sorry, I'm cognizant of time, but that's a great example, Mbogo. I think that's good. I'm going to move quickly to Michelle.
Yeah, maybe just a slightly different perspective on this again, kind of sitting in the role that I sit in within Shops Plus. I think as we are developing tools and developing approaches are thinking about ways to make those accessible, right? So these online tools are great examples so that anyone can go on and use them. You don't need, experts to fly in and do the process with you, but it just makes it there and accessible. I think with the hopes that can be kind of picked up and used in country without needing a lot of outside TA and support.
Thanks, Michelle. And Sumitra.
Quick response would be, in Afghanistan, we built the capacity and within the leading social marketing organization, and we connected them with the government's engagement so that, most of this capacity is shared with the stakeholders, and that can be repeated or replicated nationally by the local capacity. Similarly, in Tanzania, all the capacity that we have been developing, it's a shared capacity. My last thing is that all the other demand generating sort of activities, as I've mentioned, that for sustainability's sake, whether it is it's being taken over by other USAID projects, or some of them being sort of replicated by the local organizations, and connecting these beauty parlors with the the private providers is a way of making things go on over a period of time. So and again, bringing this pharmaceutical players and connecting them with this social marketing organization is to bring in their marketing sort of training materials for these markets, so that that capacity of selling these products enhances over a period of time.
Thank you. I want to thank all four of my colleagues. Thank you very much to Michelle, Mbogo, Sumitra, and Ram. And thank you to everyone who joined today. This concludes our conversation on health markets. We will share the recording on our website. Please join us for our final reflections event on July 14th, where leaders from Shops Plus will reflect on results, implications, and what the future holds in engaging the private sector to improve health outcomes. You can register via the link just shared in the chat. Thank you very much, everyone, and have a great day, evening, weekend, etc. Thank you very much, and goodbye.
Thank you.
Thanks, everyone.